Brought to you by, no. Okay, so, just like we said, what is this left side of the heart? What happens to it when there's too much pressure in the rest of the body? What happens to this side of the heart? It swells, called? Hypertrophy. Okay, cool. Hypertrophy just meaning that there's a swelling. It's being hyperinflated. So we know that this aorta pushes blood to the rest of the body. So if there's way too much blood in the rest of the body, we have a traffic jam, and all that pressure is going right back in, which makes this left side of the heart bigger, because we need more pressure to push against it. Okay, we know that about the left side. Let's switch to the right side. What is this? We have deoxygenated blood coming back from the body, going into our superior and inferior vena caves, right? Fancy word for it. The body's vacuuming deoxygenated blood from the rest of the body. Because the blood picked up its products from the warehouse, what's in our lungs. Picked up, what's the product? Oxygen, right? Where is that oxygen delivered?
The body, the entire body. The lungs.
From the
ventricles.
And then where is that pathway? What is it called? Veins or arteries?
Arteries.
Arteries push away, right? A for away. Veins vacuum back. So arteries are oxygenated because they're coming from the heart. Veins are pulling that vacuum, for V for veins, vacuum, is vacuuming that deoxygenated blood from the heart. Cool? Or from the rest of the body. So the veins are pulling that deoxygenated blood into that right atrium. Where does it go after the right atrium?
Right ventricle.
All right, very cool. Right ventricle. Deoxygenated blood or oxygenated? It's coming from the body.
Deoxygenated.
Deoxygenated, cool. So what do you think this blood is trying to get? Where is it trying to go if it's deoxygenated? To the lungs. To get oxygen, right? Of course. This is basically your warehouse. To get more product to send to the rest of the body. So, where do you think this right ventricle is pushing blood to?
Pulmonary.
Pulmonary.
Pulmonary. Good, good, good. Pulmonaries, that's right. What's another word, layman's term for pulmonary?
Lungs.
Lungs, cool. So what happens, though, if you have a lung disease, if you have COPD, another word for COPD, you have classifications under that called emphysema, you have bronchitis, you have asthma, you can have pneumonia, or you can have fluid in your lungs. What happens if there's too much pressure in your lungs? There's a backup of traffic. What does this right ventricle have to do? Push harder, right?
Yeah.
If it can't push harder, and it's doing the best it can, what do you think happens to this right ventricle?
Hypertrophies.
It swells. Yeah, and what did you say?
Hypertrophies.
Hypertrophy. Hypertrophy, yeah. So it swells, gets bigger. So that's what we do. That's what we say. Right-sided heart failure versus left-sided heart failure. That makes sense? Because on this right side, we're pushing fluid into the lungs. If there's too much pressure in that lung, this right side is going to be swelling. It's trying to get bigger because it has more pressure to push against. So what was that left side pushing to the rest of the body, right?
Mm-hmm.
So if you have backup of fluid in the rest of the body, this side's going to get bigger. So for test questions here, and your study guide, right ventricular hypertrophy is most commonly caused by what? What do you think?
Lung disease.
Chronic lung disease.
Chronic lung disease, yeah. And some certain classifications of chronic lung disease, your COPD patients, patients who've been smoking for way too long, patients who have pneumonia, patients who can have pleurisy, all these other lung disease problems. So does that make sense? Do you guys get that concept? So I'm glad you guys understand the pathway of the heart, because honestly we did this the first day and it was a lot, especially if you've been out of school for 20 years. But it's your heart and you should know how it works. Right? So thank you for that heart to heart, brought to you by Boston Reed College.